Alright, Assalamualaikum warahmatullahi wabarakatuh and selamat sejahtera. My name is Aliff. I'm representing our team from Faculty of Hotel and Tourism Management, from UiTM Puncak Alam, and also from UiTM Dungun. I'm going to present our study title, Acceptance Level Towards Smoke-Free Policy Among Customers at Restaurants in Terengganu. I would like to thank the Committee of Conference on Sustainable Social Science, Innovation and Technology for accepting our video in this conference. All right, we'll start with the introduction. Since we have about 5 to 7 minutes, I think I will cut short in the presentation. Smoking activities give a big impact, especially to secondhand smoke. So this is named as SHS. So secondhand smoke is those that are not an active smokers, but they are exposed to the smoke by the active smokers. Due to concern of the government, the smoke-free policies have been implemented in many nations in order to decrease the second-hand smoke. In 2017, primarily in Malaysia, 29 types of public places and 9 localities had been announced as the new smoke-free places. It includes restaurants. So in Malaysia, starting January 1st, 2019, the Malaysian government have implemented the smoke-free policies in Malaysia, in restaurants, and also in any other places. But during study, particularly, we are going to focus on restaurants. Okay, these are the statement of problem. Okay, environmental tobacco smoke or smoking activities damages health, and evidence on the links between smoking and adverse health effects has been known for years. This has been proved in many medical research and clinical research. And due to the implementation of smoke-free policies in restaurants, previous studies shows that the number of customers visited restaurants have been decreased. So this study seeks to investigate customers' acceptance level towards smoke-free policy at restaurant in Terengganu. This will consist smokers and non-smokers and also ex-smokers to the study as the respondents. I will cut short the presentation. I will not present the literature review. The literature review will be included in the writing in the article. Okay, these are the methodology. These studies are mainly quantitative using a cross-sectional research design. We have conducted a pilot study with a number of 30 respondents in order to identify if there's a grammatical error or something the items did not understand by the respondents, or the format, and also the questions pertaining to the questions. And after some modification, the final instrument for the major study included 12 items. This has been modified from a study started at all 2015 by using a 5-point Likert scale. And the data collection, we are using convenience. From that data collection, we have collected about 384 usable questionnaires to be analyzed. And for the analysis, we are using SPSS to generate its mean score in order to answer the research objectives. Okay, these are the analysis and results. Okay, these are basically the demographic background. We can see here about 5 demographic background questions that need to be answered by the respondents. According to gender, the gender here, the higher percentage of gender are male with 51.3%. The age group, the more dominant age group, those are between 18 to 24 years old, that comprise of 55.2%, and the higher race was Malay with 90.9%. The major race contributed to this study, with the income range that has a higher percentage is below 1,000 ringgit. And pertaining to the smoking status, the non-smokers has the higher number of respondents with 73.7% or 283 out of 384 respondents. Okay, these are the descriptive statistics. We are using mean score and also illustrate the standard deviation in the table. There are 12 questions here. All in all, the Chrombat alpha, the alpha value for all items are considered as good and excellent, with 0.945. That's a very high alpha value. And from 12 items here, we can see that the green, the highlights with the green color here, enjoy meal. That means the questions is that the customers think they have the right to enjoy their meal without any smoking activities. This has generated the highest mean scores as compared to the others, with 4.58, and the standard deviation is 0.68685. So that means this customer perceive that this is the most important item as compared to others. Although that enjoy meal is higher than the other items, the other items also has a considerably higher mean score that range from 4.19 to 4.5. So that means the range is equivalent high as compared to enjoy meal, 4.58. So that means the respondents perceive that they have a high acceptance level to all items in the questionnaires. Okay, the discussions. The objective of the research question is to determine the customer's acceptance level towards smoke-free policy in Kuala Terengganu restaurants. By using the 12-item questionnaires, we prove that the acceptance level of customers is high. The customers perceive that all people have their right to enjoy the food without worry about inhaling cigarette smoke. This support what the finding of the research that shows that the customers have their right to enjoy their meal without any smoking activities. And customers are conscious. This is also supported by Sureda et al. 2015, that customers are conscious of the risk of exposure to secondhand smoke in terms of health. And customers want their rights during mealtime without any smoking activities. This has been reported by LIE in 2018. And in conclusion, the implementation of smoke-free policy in restaurants received high level of acceptance among customers, specifically those who have patronage at restaurants in Terengganu. And of course, ultimately, people understand the dangers of smoking to their health. I think that's all for the presentation from our group. These are the references, and I think that's all. Thank you very much for listening.